Thank you, Ray. Okay, motion number 12, the NHS campaigns composite motion. Okay, you've got 3 minutes.
Hi, I'm Eve Turner, I'm from West London, and I'm proud also to be one of a number of leading people from West London who are campaigning to defend our hospitals. We are in a situation where 4 hospitals in North West London, as part of a horrible experiment by this dreadful government, are closing accident emergencies in Ealing, Hammersmith, Central Middlesex, and Charing Cross hospitals. They're closing down our maternity unit, they're shutting down the paediatrics, and basically what they want to do is knock down our hospitals and sell off the land to private speculators. And this is very much part of who we are as Left Unity. We obviously are there to fight and defend our NHS alongside health workers, doctors, who of course are health workers, patients, and the wider community. And that's where Left Unity needs to be, and we need to do this in a non-sectarian way. We're obviously fighting not just cuts and closures, but also wholesale privatisation and massive attacks on workers' pay and conditions. In our area, the GMB, who don't always take industrial action, but are on this instance, have got a set of workers, mostly Asian women, who are paid £6.31 an hour. They have no proper holiday pay outside of the legal minimum and no sick pay. And it's fantastic that these workers are standing up and are saying no to the attack on their conditions, and are standing there as a proper example of what privatisation really means. And as Left Unity, we should be supporting them wholeheartedly, but not like some of the other left, which is pretending, under the banner of Unite the Resistance, to be representing the workers. If you see any sheets going around the country, if you see any sheets going around the country, collection sheets, they're not the GMB's ones, they're Unite the Resistance, and we should be supporting the union in a friendly and comradely way, and supporting the workers and making sure that it truly is the workers who are leading that campaign. So it's really, really important. How long have I got? 30 seconds, bloody hell. So, last point really. It's excellent, there are many other people around the country, Huddersfield, Staffordshire, we've got lots of our comrades who are working in a proper non-sectarian way. We need to build the broadest possible campaign. That means sometimes you have to work with people like Tories and others, and we have to win those people, we have to work and build a movement. We should be standing up and saying we need a real mass movement to oppose the cuts that are happening in our NHS, to oppose privatisation, to fight for a proper NHS based on the needs of everybody, from the cradle to the grave. That's what will recruit people to Left Unity, if we're the best possible fighters and we work in the most non-sectarian way. We should affiliate to keep our NHS public. We should of course produce our own material, but we should do that and show that we're the best builders and we work in the most non-sectarian and broad way possible, and we will really build this organisation out of that.
Birmingham Left Unity have asked that that be formally moved, which will save us some time. Can I just ask if there are any speakers from the floor? I would ask if people are speaking against, maybe? Which motion? Duncan has 1 point on number 13.
We discussed 13 within the Health Policy Commission, and broadly we support it. Our only concern was the third bullet point on 13 was stop the closure of hospital departments, particularly A&E. Most of the time we would support that, but we feel it was covered within point 4 of motion 11, which was a moratorium on A&E and hospital closures. Any reconfigurations must be clinically, not financially driven, and must show they have won public and professional support for alternative improved services. If we resist any closure carte blanche, it does potentially create a situation where we will prevent the improvement of services for public benefit.
Any other speakers? Are you speaking for or against? We have two speakers for, so I would prefer not to take any more. Use the microphone. I think it's important for the speakers to remember to use the microphones, because there may be people here who are using hearing loops and things like that who won't catch what you're saying unless you use the microphones. Thank you.
Sam Semoff, Left Unity, Liverpool. One of the points that's missing from the body of the resolution is a greater emphasis on the involvement of the workforce. It does mention employees, but no more. But I'm talking about the doctors, the nurses, the healthcare professionals, and the NHS workers, and in particular the trade unions. Number 13 is the only one that specifically mentions the trade unions, and that's in the last paragraph. And I think for that reason, we should support 13. Perhaps the line about stop the closures of hospital departments, particularly A&E, which Duncan referred to, could be removed. But I do think it's extremely important that that last paragraph be included in the substantive motion.
Thank you. All right, I propose we move to a vote on number 12. Those in favour? Thank you. Those against? That's carried. Thank you. Thank you. And those against? That one's carried as well. Lovely. Thank you.